Welcome to this video on UroChannel, which is about the end. I recently got a comment from one of the viewers who commented something like, well, this guy, he is telling all about healthy lifestyle and working out and not smoking and not drinking, but like anybody else, he's gonna die someday. Well, this is true, but this video is about how I meet death within my professional environment. I meet death frequently. I have met death within my family, and I have seen death myself. So being a doctor also means dealing with death. And the reason why I'm doing this video is because many people might have misconceptions about what it is to die. I think maybe most people are not afraid of death. So I personally, I'm not afraid of death. But I for sure know that I'm afraid of dying. This is the most important aspect of death, because we are going into uncertainty. We don't know what's happening. We are afraid of pain. We are afraid of leaving something behind and that we're just gone and nobody will remember us, which I think is going to be true. I have no illusions about that. Once I'm dead, my wife will remember me, but well, pretty much that's it. And 50 years later, nobody will know that I have existed. Maybe on YouTube, if it's still there in 50 years, I don't know. But thinking about death, I know that most people think like life is going on and you're improving, and then suddenly it's death. But that's not the case. Life is like you're improving, okay, then you have some drawbacks, and then you improve, and then have some drawbacks. And when the process of dying kicks in, it's not like this. It's a slow process which gradually leads you down to death. And this process can take many years or even decades. This is why I think it is important to lead a life with no regrets and to lead a life that's healthy. Because you want to keep up this up curve as long as you can before you go down. And nobody's so lucky like the neighbor of my mother's. Like he went on a vacation, and the last day when they were supposed to head home, he just didn't wake up. He was dead. Was not a good thing for the widow, but this was, in my opinion, was the perfect death. But what you have to do is to keep yourself healthy. Because if you're not, you're going to be sick one day, as any of us will. But chances are high that you're going to be a prisoner in your own body for many years, which is a bad thing. I have patients who have smoked all their lives and they come with oxygen. So when they go 2 steps and when they have to sit down in a chair, they go like, I have got to rest. I have got to rest. Do you want to do that for 5, 6, 7, 10 years? That's awful. Do you want to be as fat as you can be so that you don't fit in any chair, that you can't walk? Everything in your body hurts and you have no quality of life. And please remember, we're talking about urology here. Urology means that the function of the urinary organs very much defines your quality in life. And this is true very much for the later stages in life, like when you get into old age or even if you come close to death. Then your quality will be defined by the function of your bladder, of your kidneys. What if you have symptoms? And if you have symptoms, this can make your life a living hell. This is why I am preaching this. Don't smoke. Don't drink alcohol or drink very little alcohol. Think about what you eat. Work out. Don't do cardio all the time. Also do some strength training. Get enough sleep so that you can lead a life which is well balanced, because this will get you the most likelihood that you're going to be healthy as long as possible before you die. So I know this is not a funny video, but I think it's an important one, and it's not going to be very popular. I don't think so. But the ones who see this, who watch this video, think about it. Maybe you can make some changes yourself in your lives to make it to the better. And when death kicks in or when it comes to dying, it's not going to be that hard as it can be. And I wish for every one of us that when we come to the end, that it's going to be a happy one and a quick one, and happy as much as it can be, that we don't have any regrets what we didn't do or what we should have done. Thanks for watching. Bye-bye.